Hi, working with rare deletions, 16q microdelay. When you're working with any kind of rare genetics, first of all, you do have to understand the genetics. But second of all, you might not understand the genetics. Some of the deletions that are coming out now due to just modern technology, that you even know these things even versus 5 years ago of exactly what's wrong with your child, is amazing. So the networking is very low. Okay, so people look at this kind of diagnosis and what is going to happen with my child. Okay, this is where you have to step away. This is where you have to really enhance movement lesson, full on. Why? Because first of all, you have a child with dimorphic features. The whole midline of your child is widened. You'll see it in the nasal bridge, the brow. That's why you have to have a good ophthalmologist. And I need to see the report because I need to see how the eyes were examined. But part of the reason why in your child's case that the glasses might not even, he wants to wear them, it's just too heavy for his head. I do not want this child in sitting right now. You're already worried about torticollis. I'm more worried about scoliosis. You cannot jump on foundational milestones when they don't happen. I'm sorry, he will have global delays. But again, if you don't do this work, you're also going to have global structural issues, right? And you still don't even have a hip x-ray. The hip x-ray should be done very shortly. And I would, depending on your beliefs, I would insist on it. So what you're looking at with that too is, so there's the nasal bridge is wider. And so again, we have very, very proportional in our faces. So there's 5 eyes, 1, 2, 3, 4, 5, right? And you can see where the widening is there, the bridge. And this is what's going to cause a little bit of feeding difficulties. So when you're working with the swallow course, make sure that you're exciting the mouth, right? That suck continues. One of the things that happens is that a child might eat well, or you think they eat well when they're younger. Part of the reason they don't is because they're aging and the palate starts to rise, the mouth gets wider and bigger, and they lose their ability for suction and for the suck techniques or those kind of things, or it's harder to eat because to clear the bolus, to clear the mouth, like that's a lot, and the tongue has to work harder. Takes away from the eating. When you're going down, now you have a wider chest cavity, and you see this here. That's one of the reasons why, if you watch Aaron, you need to do the newborn movement assessment like almost on a weekly basis, because the objective here is to get these kind of movements. And again, or jumping back to with the drool, you have no established vestibular system. When there's no established vestibular system at all with him, that the drool is an indicator of the vestibular system. So, also you could be teething and stuff, but again, like I mentioned, that wide mouth, the whatever, it's just harder. These are the least of your concerns. We need to start working on stimulating the back. I have really 6 simple lessons. I want you to start doing it. I'd like you in the worried parent course to really, so you work on these things. But please, 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 we don't even have tummy time. We cannot jump to sitting. And this is where you're seeing the lag of the head, the lack of support. There's no weight transfer in any of the skeletal bones. That's what we're stimulating. You call it a microdeletion. What we're calling it, you're going to be starting to do a micro movement lesson. And that's in the best interest for you and for your child. Because the strength is not going to be a thing. And because of his condition. And I'm not saying strength meaning, muscles, right? The strength is the function of the muscles. When I move my bones, my muscles connect. My muscles start to move. And that's what the combination of. Yes, I can contract and I get movement, but that's not functional. Functional movement is my skeletal system actually is the instigator, and my muscles turn on that. Where you have this system with the microdeletion is that hang, right? And you can do it too. If we all just hang like our clothes, right? The muscles can't, even if I tighten my muscles in this condition versus if I'm here and tighten my muscles, it is a completely different muscular response. And that's what's going on. I just taught the hanging technique in training with the beginner's touch, but that's what needs to be stimulated. So again, going back to pure basics, I know you want development, but we need to get a development to start initiating with your child. It's not initiating, and that's what we have to stimulate. That's the problem with the condition, but we need to overthink it. And you can overthink it. You can watch these kiddos that have other types of rare genetics like SMA. You can overthink the system, and that's what we're after. But on its own, the system will really have the development issues of global delays. Again, you can watch the internet all day long. Don't accept it, but it's going to be work. It is going to be work, but you can't push the milestones. Every physio is going to want to do it. They don't understand working with rare genetics like I do, and like few others do, and that's what you're after. Thanks.